Hello everyone, welcome to Dentospedia, which is the most comprehensive platform for dental board exam. So today I'm going to teach you a short topic on radicular cyst. So let's get begin with the topic. So what is radicular cyst or periapical cyst? See, a radicular cyst is an inflammatory odontogenic cyst that develops at the apex or root tip of a non-vital tooth as a result of a chronic pulpal infection. Now, it is also known as a periapical cyst. See, it is most common odontogenic cyst and accounts for about 70% of all the jaw cysts. Understood? It is associated with non-vital teeth due to chronic pulpal infection. Now, what will be the etiology? See, it occurs due to long-standing pulpal infection. Now, usually associated with dental caries, trauma to the tooth, or failed root canal treatment. Now, the affected tooth is non-vital. So what will be the pathogenesis? So see, there will be a pulpal necrosis. There will be a pulpal necrosis occurs due to caries or trauma. So first is pulpal necrosis. Then infection spreads to the periapical region. Now there will be inflammation in the periapical region. So when infection spreads to the periapical region, now this causes chronic inflammation at the root apex. Now the inflammatory mediators stimulate epithelial rest of Malassez. Understood? And there will be proliferation of epithelial cell rest of Malassez. Understood? The inflammatory mediator stimulates epithelial rest of Malassez. Now these epithelial cells will proliferate. Now the central cells will degenerate and the cyst cavity will be formed. The cyst cavity will be formed. Now the cavity will fill with fluid and thus radicular cyst forms. Understood? So there will be necrotic pulp, there will be periapical inflammation and thus epithelial proliferation, and then the cyst will form. So this was the pathogenesis. So you can see in the radiograph as well, you can see the radicular cyst at the apex of the tooth. So there will be a well-defined unilocular periapical radiolucency. Understood? There will be a loss of lamina dura and root resorption. Understood? There will be well-defined unilocular radiolucency at the root apex. Now, it will be rounded or oval shape. The radiolucency will be rounded or oval in shape. Understood? Now, loss of lamina dura at the apex will be seen. It may show root resorption or cortical bone expansion. Now, radiographically, it may resemble a periapical granuloma, but cysts are usually larger. Now, it is usually asymptomatic in early stages and detected incidentally on radiograph. It may present with mild swelling, pain if infected, mobility of the tooth in advanced cases, and tooth is non-vital on vitality testing. Now, see the histological feature. So, you can see the cyst is lined by non-keratinized stratified squamous epithelium. Understood? It is lined by non-keratinized stratified squamous epithelium. Now, the cyst wall contains chronic inflammatory cells like lymphocytes and plasma cells. Now, there will be cholesterol clefts or Rushton bodies. You can see Rushton bodies may be seen. Understood? So, you can see the cystic lumen. You can see the cystic lumen and the lining epithelium showing the arcading pattern. You can see the arcading pattern. Understood? Now the deeper portions of capsules are more fibrous. These are more fibrous. Understood? There are dense inflammatory cells infiltration. So this is the histopathology of radicular cyst. Now the treatment. See, it depends on the size of the cyst. If there is a small radicular cyst, then endodontic treatment is done and proper disinfection will lead to healing. If the cyst is larger, then extraction of the tooth is done and surgical enucleation of the cyst is done. Understood? So radicular cysts arise from non-vital tooth and may resolve after proper endodontic therapy, especially if diagnosed. Understood? So a radicular cyst is the most common inflammatory odontogenic cyst arising from the epithelial rest of Malassez at the apex of a non-vital tooth due to chronic pulpal infection. So that was radicular cyst. For more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.